This is a big myth that there are drugs for the poor and drugs for the rich. True, the rich are less infected, they're less exposed to monsoons and less exposed to tropical conditions, but chronic diseases are equally prevalent between rich and the poor. Now, what happens is the rich have been able to get chronic diseases diagnosed early and therefore enter the treatments early. For instance, cancer is detected in rich people faster than in poor people. For instance, diabetes is detected faster in rich than the poor. To provide universal health care, it's important that the policy direction move towards doing all three things together. One is early detection of chronic diseases, two, providing healthcare infrastructure, and three, providing healthcare facilities or drugs at affordable prices and costs. Again, remember, we're talking about total cost of treatment, including infrastructure and drugs, and not just separated out. It becomes all the more important when we look at the middle class or the poor, where their insurance costs are very low. Their insurance coverage is very low. As the middle class and poor people are less covered by insurance, the total cost of treatment has to be reduced, and therefore there's a lot of incentives that the government need to provide in at least making sure that the drugs are delivered very effectively at those to those populations which otherwise cannot afford very high value drugs. The nature and the humans are decreasing. Human beings are losing their immunity to these viruses. When the human beings continued living with nature, nobody who lived in the forest will ever get affected by avian flu. You're so far away from avian animals that today, the moment you get in contact with the avian virus, you get affected, you get infected, and you don't have that immunity. Now, in terms of opportunity for Indian companies, it is an opportunity. For instance, Tamiflu, Indian companies have spent time and effort in developing new strains or new vaccines or new medicines for those kinds of drugs, but the speed of response required to handle pandemics like this require very, very large capability. And I don't think the Indian companies have enough capabilities today to be able to ramp up high-speed research or high-speed production of these vaccines. You need really large capabilities to speed up a vaccine development, which would otherwise take 15, 20 years to develop. You need to fast track it to 2 to 4 years. Next few decades, the Indian market will significantly grow. Grow because the population is growing and life expectancy is growing. With life expectancy is growing, diseases which come along with age, or what is otherwise in the medical terms called as geriatric diseases, are increasing. Now, geriatry as a discipline is very, very immature in India, very less mature in India compared to the rest of the world. Geriatry is one place where Indian market needs to grow, and we'll see an increased interest in geriatric. This is consistent with the way life-saving drugs are going, where in life-saving or chronic healthcare, we're talking about democratization of healthcare. You don't need to depend on a medical practitioner or a medical assistant to provide you injections or drugs. You, as a patient, should be able to take drugs easily yourself, like insulin, for instance. Till very recently, before the innovations of the pen as a delivery device, insulin had to be injected. It still has to be injected. Now, with innovations on the delivery mechanisms, you're looking at democratization. The patient herself can inject her insulin subcutaneously. So those kinds of delivery mechanisms are new opportunities.